We're reviewing the cardiovascular system and we're looking at the blood supply to the brain and then through our arms right at the top of the heart. I think it's good to start with just understanding how do we provide this blood supply because in a couple spots it's asymmetrical. I've been teaching anatomy for about 24 years now, and I like to simplify in different areas. And I think this is one way to start when you're looking at the highway system for good and bad blood. And when I say good blood, I mean oxygenated. Bad blood, I mean that the body's used it and brought it back to the heart. So we're looking at just how do you describe the vessels, the veins and arteries that are supplying the blood to and from the heart, specifically with the head and the arms. So let's talk about how do you get out of the heart? Well, how do you bring blood back to the heart? So we bring it back first by these two. Number one here is from the brachiocephalic. So these are brachiocephalic trunks here. So brachiocephalic veins, brachio referring to the arm, cephalic referring to the head. So that means if I take number one here, we're bringing blood back to the heart. So how did that occur? So that number one is down here. Here's my two brachiocephalic veins. They're coming from the arm, which means that it's coming from my subclavian, which means it came from my axillary. Axillary referring to the armpit region. Referring to those veins, the blue, I bring it back from axillary, and then it turns into subclavian because we're going below or deep to the clavicle, that then converges at the brachiocephalic. So that's our brachial side. From the cephalic region, what we're seeing is this large vessel here, which is the internal jugular. So internal jugular is this large vein, internal jugular, and then just to the outside, the smaller one is external jugular. So you can see those two main jugular vessels are veins that are bringing blood supply back from which we use from the heads, from the cephalic region. So these two jugulars, the big one internal, the smaller one external, will dump into brachiocephalic vein. So if I bring in those two brachiocephalic veins, then it goes into superior vena cava that then dumps into the right atrium. So we brought all that blood in, circulates through the heart, gets to the lungs, comes back to the left side of the heart by way of the left ventricle. I come out through the aortic valve, which I can't see on here, but then hits the aorta, so we're hitting at the ascending aorta that will curve into the arch of the aorta. And from that arch, then I have 3, 4, and 5. So number 3 is a brachiocephalic artery. There's only one brachiocephalic artery. We call that the trunk. Brachiocephalic trunk, because it's going to trunk and branch into a brachial side and a cephalic side. Number 4 is looking at my common carotid, so specifically the left common carotid artery. Number 5 is my left subclavian. So coming directly off the aorta, I have 3 major vessels. These arteries are now supplying that good oxygenated blood that goes to the brain and to the arms. So as I look at first, this is asymmetrical. Number 3, we said, is the brachiocephalic trunk. It's the artery that splits here. So number 3 is going to split and go to the arm and to my head. And so as I go through the arm, it's going to have the same names as the veins, subclavian artery, which will branch later into axillary artery. From there, I then go up and I supply by way of the right common carotid. So the right common carotid is coming off the trunk as well as the subclavian. So it's asymmetrical on the right side. So I have 2 brachiocephalic veins. I have 1 brachiocephalic artery. Let me say that again. I have 2 brachiocephalic veins bringing blood back to the heart. I have 1 brachiocephalic artery, that's the trunk on the right side, that's going to supply the right side with good blood, going to the arm and then going up through my right common carotid, would then split into my internal carotid, which is going to feed the brain, and then also my external carotid because it's going more superficial. So in review on the right side, brachiocephalic trunk, that artery splits into subclavian to go to axillary, then becomes brachial, then radial, then ulnar. As I come up, This turns into common carotid artery on the right side. So my right common carotid artery splits into my internal carotid artery and my external. The other thing you're seeing here is your vertebral arteries. Remember our transverse foramina, the holes of the cervical vertebrae allowing for blood supply. And we have an alternate way to make sure we're getting blood to the brain. It feeds roughly about 20% of the brain. So you have different ways you can feed it because brain needs its oxygen. Okay. As I go down to the left side, we said 4 and 5, they're coming directly off the aorta. So in this case, my left common carotid artery feeds directly off the aorta, but does the same thing. It's feeding into my internal carotid, which is on the left side, and my external carotid. So now it's symmetrical. It's just at the point where it comes off the aorta. And then number 5 is my subclavian, but my left subclavian that would turn into axillary, brachial, and that's where it gets easy because the names will start to repeat with the veins and the arteries. Veins bring blood back to the heart, arteries take it away from the heart. So first, understanding just the vessels as I come off the heart is very important because you're trying to understand first that it's asymmetrical, that my brachiocephalics are different. I have 2 brachiocephalic veins, number 1, and then number 3 is my 1 brachiocephalic artery, that trunk on the right side. So we understand the asymmetrical, but then how do we then converge to feed to where then it ultimately becomes symmetrical? So this is arm and neck vessels, just the starting point of understanding the highway system for blood with the cardiovascular system.